Hey guys, let's talk about hip flexors. So this is a major problem that we see in a lot of people. And you guys know it's my job to remove nerve interference, not to stretch your muscles out. So let's talk a little bit about a really common one we see, the psoas major, or in layman terms, the hip flexor. So people with really tight hip flexors are usually people with weak glutes, people who sit a lot at work. And so if I'm sitting, that's going to put put a lot of slack into the hip flexor, and eventually it will start to shorten and create adhesions, and that creates problems. So I'd like to show you what that actually looks like on the spine. So this hip flexor, you have one on each side, and it's this muscle in green right here that actually starts on the spine, the bones, and the discs. Can you see that okay?
Yeah.
Okay, so it starts on the spine, the bones and the discs, it attaches there, and then it's going to come down in front of the hip and attach to the front inside portion of the thigh bone, the femur. So you can imagine if this muscle engages, if it contracts when it shortens, so what's going to happen is you're going to pull the leg up into this position and slightly, I want to say external rotated. The main component of that motion is we're flexing the hip, we're bringing up into that position. So you can imagine someone who sits all day, this is going to get real short and tight. The reason this is a problem is because the same way the bicep and the tricep can't fire at the same time, because the bicep does this, the tricep does that. If they fire at the same time, I'm stuck, I can't go anywhere, they're both acting. So if I want to use my bicep, my tricep has to relax, it can't do anything. So that allows me to lengthen the tricep and contract the bicep. Likewise, the other way, the bicep has to turn off in order for the tricep to turn on and perform its action, okay? So you could imagine if someone has a really tight hip flexor, then they're not gonna be able to use their glutes, okay? So that's essentially the same action that's happening at the hip. So if I'm stuck like this, I can't use my glutes. Well, your glutes are really important. A lot of people have glute amnesia. They literally forget how to use their glutes. Kelly's laughing back there. So what we want to be able to do is use the glutes in order to pick things up properly off the ground, right? So everybody talks about proper lifting, you got to do it, right? But if you literally can't turn a muscle on because the other one is not allowing it to turn on, then you're going to have a lot of trouble. Even if you're using proper lifting technique, you're not using your glutes because you can't. You're going to compensate and use your back muscles, and that's when people get into trouble. So the way that I tell people to fix this is to lengthen the hip flexor and strengthen the glute. So lengthen the front, strengthen the back. So if we think about this muscle here, the way to lengthen it, which is what you need to do first, is come down here in this 90-90 position. So notice this knee's at 90, my hip's at 90, this hip is straight, my other knee's at 90. I want you to go this way, sink back to put slack into that hip, okay? And so now what I'm going to do is engage my glute first. Now that the psoas is turned off because there's slack there, I'm going to engage my glute. The way that I engage my glute is I try to push my hip forward, okay? So I can feel I'm contracting my glute. If you can't do this, if you can't turn your glute on, then that's what you need to work on first before you do this stretch. Learn how to contract that glute, and it should be kind of tight, hard. So once the glute is contracted, keep it contracted and lean forward. Once the glute goes soft and you lose it, you gotta come back and start over. Turn the glute on again and then go forward as far as you can until you start to feel the stretch in the front of that hip flexor, kind of in your stomach a little bit too, because remember it stretches that whole distance. Okay, I want you to be able to hold this for at least 30 to 45 seconds, breathing, okay? Which takes work because I have to keep that glute contracted and I have to engage my core. Here's where people go wrong. They get into this position and they just go down here. I'm not doing anything. I'm bending my spine here because my glute's not engaged, so my hip flexor's still tight, and it's my spine that's bending in order for me to get that range of motion. I don't want that to happen. In order to actually stretch the psoas, you need to do these things first. You lean back, if it's the right side. You engage that glute first, and then you engage the core. I'm not hollowing out my core. I'm not straining to where I can't breathe. I'm just engaging it. So if you poked me, you'd feel that I'm actually using my core. So butt's engaged, core's engaged, I'm straight up and down, I'm breathing, and I slowly lean forward. If you're doing this right, you should feel it pretty quickly if this is actually an issue for you. If you start to find that it gets easier and you can stretch a little deeper, good. Just check yourself to make sure the glute's still there, the core's still engaged. And if you want to take it a step further, you can even bring the arm up like this, like you're stretching the tricep, and that'll start to put a lot of length through here. And so right there, if you can do that 45 to 60 seconds, you're doing pretty good.